Okay, so you've prepared your medicines at the table. They've been checked off by the instructor that is doing your med check off. Now you've come to your room. Knock, knock. Hi, Mr. Hanson. My name is Miss Capehart. I'm going to be your nurse today. I have some medications to give you. Can you tell me your name and date of birth? I'm going to verify their name and date of birth and their allergies with what you have on your paper, and they should be the same, okay? So now you can announce, I'm going to do my third check. You're going to check again your meds against your MAR and make sure they're correct, okay? Third check is done. Okay, if you have a patch, you want to do that first, especially if it's for pain or chest pain. So you're going to want to get your gloves and put those on. Mr. Hanson, did they put a patch on you yesterday that you know of? You're going to have looked to see if they did or not in real life. So you'll want to, if they have a patch, you're going to want to make sure, if you're doing a patch, you want to make sure you get a wash rag, because you'll take off that old patch and you'll wipe it clean, because you want to wipe off that medicine. You don't want to put new medicine and have old medicine on there, or they'll be getting a double dose. So you want to wipe it off. Okay, you've got the old patch in your hand. You're going to double glove it and throw it away. Okay, then you're going to get a new set of gloves to put on the new patch. Some students asked me if I would demonstrate putting on a patch, so I'm going to do that. I'm not going to use that glove, it fell on the floor. Okay, so I'm going to demo it here on the back of their arm so that y'all can see it. Okay, so I'm going to open my patch and get it out. This one's a little round patch. If you look on the back of the patch, you'll see that it folds in half. So you're going to remove one half of that patch. See how I can push that up and get that off the edge so I don't touch the medicine. Okay? I'm going to throw that away. So then I'm going to place that on his skin, that side on his skin. If I roll this back, I can do the same thing. I can push up and that side's going to come off. Okay? Then you're going to want to write on your patch your name, title, date, and time when it was put on. Okay? I'm going to try to move this patch so y'all can practice with it. So bed 1 will have a patch on. Okay, so there's your patch. Okay, so I finished my patch. I'm going to take my gloves off and throw them away. Okay. All right, Mr. Hanson, I've got some other medications for you to give. Could you take a sip of water for me first? That's to check your gag reflex. Make sure you give him a sip of water before you start giving him meds. You check that gag reflex, okay? Takes a sip of water. Okay, so Mr. Hanson, I have your metoprolol here for you. Your blood pressure this morning was 138/82, and it looks like the doctor has increased your blood pressure. So I've noticed that on the MAR, it's also on the order, but he's in here for CHF, hypertension, and asthma. So, and his blood pressure is elevated, so the doctor's probably either added another medicine or increased his medicine. So if he says that it's different, that's probably why. So here's your metoprolol. So since this is your first dose, having metoprolol, it can make you dizzy. So when you get up to go to the bathroom, make sure you let us know, okay, in case you get dizzy. And hopefully that will start working to help bring your blood pressure down. I've also got your aspirin for you. So since this is in a package, we didn't have to label it. So when we came in the room, we gave him his metoprolol. We could just break this over a cup and give that to him, okay? So this is your baby aspirin, your 81 milligram baby aspirin. That's a blood thinner, helps prevent clots. I see you're on that at home. Do you have any questions about it? No? Okay, great. All right. So next I've got let's say it's some insulin for him, okay? Like we drew it up, we got it checked. Okay, so Mr. Hanson, I've got your insulin for you that the doctor ordered. Where would you like me to give that? They say they don't care. You want to give it in the back of their arms. Save the stomach for them to use to give their injections. use the back of both the arms in the hospital, okay? So you would ask your instructor, this is a sub-Q injection. Where would you like me to give it? We're going to tell you, sub-Q. You're going to show us on the mannequin where that would be. If it's an IM and there's landmarks, you would tell us what those are, and then you'd give your injection into the injectopad. Remember, it's a dart. Don't dart in with your thumb on the plunger. You'll lose medicine, okay? So I'm going to take this out. I would have gloves on. I'm going to scrub my patient, and I'm going to dart in and give my medicine, okay? Then I'm going to walk straight back here, making sure no one's in my way, and I'm going to put it in the sharps container. I don't recap. Once you use it, you don't recap, or you lose it. You fail. We don't want that, okay? So once you use it, you don't use it. You put it in the sharps container, okay? So I've finished giving all my meds. I've given everything to my patient. I'm going to document before I leave the room. Scheduled medicines, I'm going to write my initials right here. I'm going to sign an initial down below. PRNs, I'm going to write the time in the right box where it goes, depending on what time you gave it. This was 0900, so it will go here. I'd write 0900 and my initials, and then I'm going to write a nurse's note because it's a PRN. Okay, why did they need it? If they refused a scheduled medication, you draw a line through it and initial. That will also need a nurse's note of why you didn't give it. Patient refused it, didn't want to take it today, didn't feel like you needed it. And depending on what the medicine is, you're going to need to let the doctor know why they didn't take it for that day, okay? I think I've covered everything that you need. You can have your drug book and your med sheets here at the bedside. Remember I said you can bring in blank labels, and you can, at the table, you can label your drugs that you're using so that you can quickly find them at the bedside. If they're not in your med sheets and you're looking for the drug in your drug book, go straight to the back, find out what page it's on. Don't try to thumb through the alphabet. Go straight to the back, try to find what page it's on, okay? Then I would wash my hands. If you gave him a PRN, you'll tell him I'll be back to check on you in about 15 to 30 minutes to make sure that that's working, and you'll leave the room. You'll take your pills back to your med box, and you're done. We will turn the timer off once you've documented on your drugs. Once you've either documented, or if you forgot to document and you leave the room, that's when your time will stop, okay? You've got 45 minutes to get it done. I know you guys can do this. You need to practice, practice, practice. If you're even questioning it a little bit, be here on your lunch break and be practicing. Anytime you have practice, the lab's open 8 to 5. Somebody's usually here 8 to 5 to let you guys in the lab to practice. If you come into practice, remember to sign in the book. All right, guys, good luck.